Welcome, everyone. Thank you for joining Continuous Learning with BioGuard. It is my pleasure to introduce our webinar speaker, Dr. Susan Sedotra. Dr. Susan obtained his PhD from National Tsinghua University and Academia Sinica, Taiwan. He has expertise in biomarker discovery and protein structural biology. With a strong research background in investigating potential biomarkers for target diseases. Currently, Dr. Susan works as a diagnostic specialist with BioGuard Corporation. As everyone knows, feline upper respiratory infection is a common illness in cats. The most common pathogens that cause upper respiratory infection in cats are feline herpes virus, feline calicivirus, Bordetella bronchiectatica, and Chlamydia felis. Dr. Susan will share clinical signs, treatment, and prevention of feline upper respiratory infection caused by the virus disease in this webinar. We are glad to have him as the speaker for this webinar. Without further ado, let's welcome Dr. Susan Sedotra.
Good evening, everybody. My name is Dr. Sushant, and I'm very glad that today you have joined the webinar. Before start, I would like to say Happy New Year to all of you. And I hope this New Year will be very prosperous to all of us. Okay, let me share my screen to you. Yeah. So it's okay, right? Okay. So so as we know that today's topic of our talk is feline respiratory infections. So feline respiratory infectious diseases is most commonly seen in all the cats that are usually living together in multiple household conditions or boarding or breeding establishments. So as you know that because of this infection, most of the common diseases or disorders that can occur can be conjunctivitis, rhinosinusitis, lacrimination, salivation, and oral ulceration. And regardless of the cats, both exotic and domestic felines are prone to be infected by respiratory diseases complex. So there are many causes which helping or causing the disease in the cat. Most of the common caused by viruses, which is 80 to 90% of the cases. And other than that, there are other factors such as bacterial and fungal infections, FECV, FIV infections, etc., which also coexist with feline herpes virus and calicivirus. So the most common causes for respiratory diseases, which covers 80 to 90%, is because of feline herpes virus 1 and feline calicivirus. So with that, there are some other pathogens such as Bordetella bronchiectatica and C. felis, which are also participating in feline respiratory disease infection. So let's talk about more about feline herpes virus and feline calicivirus. So feline herpes virus was actually first isolated from cat in 1958 in the United States. And at that time, it was the most severe disease found in the cats. And regardless of feline calicivirus, which was discovered earlier in 1950s with the same kind of prevalence in cats. However, it was researched at that time already known that feline calicivirus is antigenic diverse than feline herpes virus. So let's go into detail about feline herpes virus infections. So feline herpes virus is a typical alpha herpes virus which containing double-stranded DNA with you can see the enclosed by different kinds of glycoprotein lipid in his envelope. So these glycoproteins are actually responsible for the detection of the host cells and also causing the start of the infection in the host. And this virus is very stable in lower temperatures. It can remain infectious at 4 degrees for about 5 months. However, in room temperature, it can be reduced to 1 month, but it will be in an inactivate state. However, when the temperature rises more than 30 to 56 degrees, the inactivation can be within 4 to 5 minutes. And this virus is also very susceptible to disinfectants, antiseptics, and detergents. And as I mentioned that this virus doesn't do much of the mutations and it has very little strain variations naturally. So talking about the epidemiology of this virus, so of course in feline herpes virus, the domestic cat is the main host of this virus, and prevalence of viral shedding would be that if we talk about the healthy population, which are usually the household cats, will be less than 1%. However, if this population will increase, the clinical signs will also be increased, and it would be like 20% of the cats may be showing shedding of the virus. If the area will increase more, such as in shelters and in boarding caterers and other establishments, there is a 50% chance that the cats may excrete the virus in large load. And lately, in certain scenarios, that infected queens or the mothers may transmit this virus to their offspring. However, it's not very much clear or seen that transplantation infections have been seen in the cats, or also there is no evidence that humans are also getting infected by feline herpes virus. So when we talk about the career stages of this virus, so basically, it's because of the stress that sometimes the cat will start to shed the virus if it has pre-infected by the virus. However, if it's a new infection, then it will take 2 to 6 days where there is the incubation of the virus in the host. And then the acute infection will start with some clinical signs, and the cat will start shedding the virus in large quantity. However, after 6 to 3 weeks, these clinical signs will improve, but the virus will enter into latent infection stage, where you will not see the clinical signs, but the virus will still be present inside the host. And after that, after it depends on cat to cat or during variable times, that, as I mentioned before, due to stress, the pre-infected cat will start, shedding the virus again. However, this shedding will not be very immediate. There is a lag phase of 4 to 11 days after while there is a stress. And then the cat will probably may or may not show some clinical signs of the infection, but it will start shedding the virus again after 4 to 11 days for 1 to 13 days. Yes, which will can infect other healthy cats around. And other than stress, there are some other factors such as glucocorticoid treatments, which can also lead to cat for shedding the virus in the environment. So the pathogenesis of this virus starts with the nasal, where it then enters into the oral and conjunctival roots, and where it causes certain infections, and also it can cause lytic infections in the nasal epithelium and gingivital sacs, pharynx, trachea, bronchioles, tonsils, etc. The main effects of these lytic infections can be seen as a lesions where multifocal necrosis of epithelium layer will be there. And also when it happens to the granulocyte infiltration, then of course, inflammation and redness of the area would also be seen. When these lesions will increase, it will can lead to chronic lesions in the upper respiratory tract and also in the ocular tissues. So you can see some of the examples where the chronic infections will cause conjunctivitis in the corneal ulcers, and also it can cause stromal keratitis and nasal tube damage. Here I have seen some of the examples from previous studies where you can see corneal ulcers in the first picture and also stromal keratinitis in the second picture. So as I mentioned that after 2 to 3 weeks, these clinical signs probably will increase if it's not very chronic. These early acute signs will increase. However, the infectious will enter into latency stage where it will spread along with the sensory nerves, and then it will reach neurons where it will infect trigeminal ganglia. And you need to know that this kind of infection is a lifelong latent infection where cat will carry the virus for its whole entire life. So when we talk about the immune response, of course, when this infection is happening in the kittens, there is a maternally derived antibodies, NDA, which will, try to defend the host. However, as we know that MDA generally doesn't long last. So in the kittens, it will vanish in 6 weeks of age. So that's why vaccination is prescribed at that time, which we will talk about later. However, in other cases, when the cats are infected, there is an acute immune response, which is induced by the glycoprotein envelope of the virus, and which will cause for the release of virus neutralizing antibodies, VNA, in the blood. And also it will further induce antibody mediated cellular toxicity in the cells, and further it will cause antibody induced complement lysis of the infected cells. So after the cat will get infected, of course, we will see some of the clinical signs, some of them which I mentioned before. Here, this is more elaborate. Like, for example, if cats first show the very common signs of sneezing, nasal discharge, or conjunctivital hyperinemia or cirrhosis discharge, it can be a cause of acute disease, which is a classical form of clinical signs. Uh, Other than that, there are some atypical acute diseases where there is a nasal and facial ulcerations and crust formation lesion, yeah, which can be severe, and also it can also cause severe coughing and even can cause death. Other than that, when it leads to the chronic disease condition, then there are stromal keratitis, as I mentioned before, where you can see the corneal area, vascularization, blindness, and other chronic sneezing and nasal discharge. Yes. So let's talk about the diagnosis of feline herpes virus. So as we know that the golden standard diagnostic is the PCR, where we can detect the FHP DNA in the sample. So the sampling can be from conjunctival area, corneal, or oropharyngeal swabs and corneal swabbing, and other forms such as blood or biopsy. So after that, the method which we can choose for PCR, it can be a traditional or conventional way of PCR, and it can be nested PCR or real-time PCR. And as I told you that the virus doesn't have much of the variance, so the many of the regions in the genetic material are conserved. So for the PCR primer designing, uh, we can prepare the trimers according to the conserved thymidine kinase gene in the viral genomic DNA. However, there are some factors which can affect PCR, such as less viral nucleic acid, like the collection of the sample is very less. So the amplification will also be not very good. And also when there is a viral DNA in swapping of the cornea or tonsils area, then it can also be detected. Also, when it can detect the FVH feline herpes virus DNA in modified live virus vaccine. So if the cat is early vaccinated, yeah, then also it's a problem for the PCR to detect the real disease. So for this purpose, we can modify the PCR to quantitative real-time PCR, which can give you more reliable results as it can measure the amount of virus. So when there is a high viral load present in the sample of suppose nasal secretion or tears, so it can, give you an idea about that there is an active replication or there's a real involvement of the virus because of what clinical signs are happening. However, if there is a low copy number, which will detect in the PCR results, which means that either the corneal scrapping, in the corneal scrapping, I mean the sample, yeah, this would indicate that there is a latent infection, which means that the virus is still there, but it's in a latent infectious stage. So for this, in our laboratories at BioGuard, we have our own small qPCR machine, which we also commercialize for our, going to commercialize soon for our international clients and customers. So here, this machine actually is a whole package where you can see we have a nucleic acid extraction, and also we have a small PCR device. So the procedure is very similar to the other PCR machines, which is like we have a sampling, then we do the nucleic acid extraction, and then we do the PCR testing. The benefit is that first of all is of its small size, that it fits to small clinics and hospitals. Second is that it's a fully automated machine, which you don't need, highly technical support for that. Yeah, if you know basic molecular biology handling, yeah, this machine, the procedure will be easy to follow. And also, this machine comes with PCR detection kits, which are ready to use kits just after the sampling and nucleic acid extraction through our nucleic acid extractor. You can directly use the PCR detection kits to do the PCR testing. For example, in case of feline respiratory diseases, we have a kit of feline respiratory, which contains 4 items in it, such as feline calicivirus, feline herpes virus, C. felis, and Mycoplasma felis. So these 4 pathogens can be detected in this one test. Yeah, so it's a very reliable result and very useful for small clinics and even the hospitals. Yeah. So moving forward to other diagnosis options. So the other one is, of course, the viral neutralizing test or ELISA. So this kind of test can detect the antibodies of the feline herpes virus. And sampling can be from serum, it can be from aqueous humor, and also cerebrospinal fluids. However, antibodies detection also through ELISA also has some factors affecting this procedure, is such as whether the infected cat is naturally infected or is because of vaccination that ELISA is giving the results of positive. And also if there is a neutralizing antibodies which could be undetected in the test. And also if the antibody load is very low in the sample in form of acute or chronic disease animals, then of course this test will cause false negative results. Talking about ELISA test in our laboratories, we use immunochromatographic assays in form of a rapid test kit, which will give you more reliable results for detection of feline herpes virus antigen, and this is the antigenic detection test, and in a combination of feline calicivirus, and this test is like a combo test which we use in our laboratories. This test is also can be used from our company for commercializing, and all our clients can purchase these kits. As you can see, the sensitivity and specificity of these tests is 97 to 100% for feline herpes virus, and for feline calicivirus is also falls in the range of 97 to 100% when we compare to the golden standard tests such as RT-PCR. So this test is also can show a very reliable result in a fast and in an accurate way. However, the difference is that our qPCR machine can give you a quantitative results, and our rapid test kit for feline herpes virus antigen can give us qualitative results. So let's talk about the treatment methods for feline herpes virus disease. So as we know that, first of all, there are like some topical treatments which based on the early clinical signs, such as if there is a nasal discharge. So nasal flushing can be done through saline solution. And also it's recommended that we should clean the nasal quite often or several times in the day. Or since because of the irritation of the nasal passage, the cat might not be eating very properly. So it is very necessary that we should feed the cat, try to give the food intake sufficient. And also because of the ulcerations of the oral cavity, the food intake would also be less. So in this case, there can be a food tube, which can be like a oral esophageal tube can be used to, feed the cat. And yeah, so the third method is the placement of the feeding tube and internal nutrition to ensure that there is a sufficient amount of food intake for the cat. So when we talk about systematic treatment, like if there is a need of hospitalization, then the fluid therapies can be given to the cat to control the dehydration or to restore the electrolyte balance in the body. And also some kind of antibiotics can be given like a broad range of category of antibodies to control the secondary bacterial infections in the cat. So these antibodies can be broad spectrum or it can be specific, depends on the clinical signs or the severity of the disease. And also a non-steroidal anti-inflammatory drugs can also be given to decrease the fever or other kind of signs such as inflammations, etc. So when we talk about acute oral ocular diseases such as conjunctivitis or keratitis, which are can be treated through antibodies, which can be topical antibiotics, and also anti-inflammatory drugs to decrease the local inflammation, usually which can avoid, and we can avoid glucocorticoids in this case. However, there are some antiviral drugs which are also there in the market, but they are not very specific for feline herpes virus, but still can be used, such as trifluridine or cidoforivir and idoxuridine. Yeah. So when we talk about the dosage, like a route of administration, so you can see that like a drug such as famicloravir, which is an antiviral drug or a nucleoside analog, it can be given orally in a range of 90 mg per kg of the weight of the cat for 21 days. And if we are giving interferons such as Feline, INF omega, then it can be 1 mu per kg. Yeah, and it also can be given orally on a daily basis. However, in some severe cases, human interferons are also suggested by the veterinarians, and the doses can depend on decided by the veterinary at that time. But usually it's usually we started with a low dose, yeah, and it can increase from 5 to 35 units daily, yeah. Yeah, so this was all about feline herpes virus. So let's now know some more detail about feline calicivirus infections. So for feline calicivirus, it's a very small virus, which is also and involved by single-stranded RNA virus, which is a bit different from feline herpes virus, which is a double-stranded, and it belongs to the member of Vesivirus genesis of the calicivirus family, and it's a non-enveloped it is covered by a non-enveloped caspase, which is around 20 to 40 nanometer in diameter. And also there are some caspase proteins present outside the virus, which are known as BP1. And in total, there are like 180 caspase proteins which are present there. So a large number of different strains of FCV virus exist in the environment. This is because each time the cat get infected by feline calicivirus, it usually involves his own strains in his body. And when this new strain enter into the environment, yeah, so by the time, yeah, it infects other cats, and different strains get circulated in the environment. So FCV evolution is not associated with selection competition, because this kind of virus is actually involved individually in one organism. So it's not because some strains, the mutations are stronger, so that's why they can survive in the environment. It's not the case in this kind of virus. So, and also different kind of strains will induce different clinical signs or illnesses in cats. So yeah, the severity or the chronic or acute stage will be depends on how many and what kind of strains of feline calicivirus have infected the cat. So for the epidemiology of feline calicivirus. So we can see that feline infections is widely spread in cat population, as we know that this is because of the external environment, and also the virus can stand the environment for very several weeks. It can also stay at dry surfaces at room temperature, and also in cold conditions, this can be go more longer for the survival of the virus. When we talk about the carrier stages, of this virus, so as we know that prevalences will be more in the individual colonies and the cat shelters, which will be 50 to 90% that cat will be infected by feline calicivirus with the strain diversity in that case. However, in case of household cats, the prevalence percentage will get lower to 10%. Yeah, so there is a less chance of infection in the cat. So as we know that this virus is always there in the environment, and most of the cats actually are carrier of this virus. However, if we see this carrier stages, so we can start from when the healthy cat will get infected by the virus for the first time. Then there is the acute infection where the disease will enter, when the virus will enter into the cat, and then it will start shedding the virus after the virus start replication uh, in the host. And the shedding will be at a very large quantity. However, when the cat will be okay, probably after 30 days or so, the clinical signs will improve. The virus shed will also decrease at that time, and probably after some time, it will totally will stop shedding the virus. However, in that case, the cat will enter into in another stage where there is some other strain which is involved in the cat, and slowly that new strain of the virus will start enter into the environment when the cat will start shedding that new strain of virus into the environment. With that, this new strain, the clinical healthy carrier will can undergo cycles of infection and with other strains present around the cat. And this will also can be the infection can be with a similar strain or can be from a different strain. And the same way the cat will have shedding of the virus. And this is how the new strain will evolve in the environment. However, the cat can go in recovery stage also, where there will be no further shedding, and then it will be totally recovered and the virus will get eliminated from the body of the cat. However, the environment is the main factor for the infection of feline calicivirus, because the shedded virus by the infected cat can survive in the environment for a long time. So when we talk about the transmission, so the cats with acute diseases will shed, of course, the virus to the very predominantly, which will enter into the new cat or the healthy cat through oral or nasal form, and through oral or nasal passages. And also for the shedding, it will happen through oral and nasal secretions. So the transmissions can be in two forms. One can be directly when healthy cat will come in contact with the carrier cat. And another form is indirect method where there is a contamination caused by the carrier cat when she is shedding when the cat is shedding the virus into the cage or the feeding or the clinical cleaning tools or any personal items used by the cat. So other than that, it is also seen that the feces of the fleece of the feces which fed on the feces of the infected cat can also show the can also transmit the disease in an indirect way. So when we talk about the pathogenesis, as I also mentioned before, that the virus will enter into the healthy cat through nasal, oral, or conjunctival routes, and it will enter then into the oropharynx region, which is the primary site for the replication of the virus, and also further, it can cause the necrosis of epithelial cells, which will lead to tongue ulcers, which is a very common clinical sign in this case. Further, it can also cause a very distinct syndrome, which is called limping kitten syndrome, where it affects the joints and the lungs of the cat, leading to pneumonia or lameness. So these are some of the clinical signs which can be seen after the cat get infected. One is of course the oral ulceration, which is the most common symptom or the clinical signs can seen. So you can see two of the examples here where you can see the ulcerations on the tongue area of the cat. Another clinical signs which are related to upper respiratory tract diseases such as sneezing, nasal discharge, fever, anorexia, hypersalivation. The cat will also have depression, especially in the kitten, and also corneal ulcers. So, so in the chronic form of feline calicivirus infections, which can cause feline chronic uh, gingi, gingivosotomatia, sotomatic, so, sotomatitis. I'm sorry for the pronunciation. Yeah. So FCGS is, as I mentioned, that it's a chronic form of the disease where there's immune-mediated reactions happening in the ocular region, especially around the cheek area and the tonsil area. And this is inflammation can extend to the alveolar mucosa and other soft tissues around the respiratory tract. Other than that, as I mentioned before, there is a very special limping syndrome also occurring in the calicivirus infection in the cats, especially in the kittens, young kittens, because it can cause arthritis case in the kittens. So how it was identified that the kittens will start limping uh, uh, because of this issue because of infection, and the fluid in the joint area actually was seen that it contains feline calicivirus. So that's how the limping syndrome was associated with feline calicivirus, which is causing very uncomfortable situation for by the time. So later, when there is a kind of an outbreak of this feline calicivirus, so virulent uh, systematic FCV infections can occur where there is the involvement of multi organs and even can cause death. So this cause of pathogenesis is because of the virus evolution by the time, and also because of the immune-mediated components present in the environment and other management factors like such as hygienic and other cases. So that's why this kind of epidemic situation can happen in for cats also. So so because of this epidemic situation, the different kind of virulent strains will evolve uh, in by the time, which will have different cell proliferation, tropism, and also can grow rapidly in the cat. So virus systemic feline calicivirus infections will cause more, severe clinical signs, such as there will be a very high virulent load, which will be seen in the cat, and after these kind of clinical signs will be very lethal. And so you can see that here the legends are not restricted to the oral area, but it will increase to the outside the skin and also on the nose, lips, ears, eyes, and foot pads. You can see the lesions very clearly. And there will be also seen inflammation response syndrome uh, also in the cat. So with that, multiple organs will also get affected because of the infection, and which will lead to organ failures and of course the death. So that's why in these kind of epidemic situation like VS, FCV infection, so mortality rate is very high from 30 to 70%, depends on the environment and the factors. So not only this situation, but most of the respiratory diseases for the cats, there are like co-infections occurring, such as the basic one is, or the most common one, which is usually seen, is the co-infection of feline herpes virus and feline calicivirus or together. So since both are respiratory diseases, so which will cause the airway damage to the for the cat, and also it will reduce the mucociliary clearance because of the nasal discharge and other ocular issues. And also in a chronic cases, it will have impaired immune defenses, so which will cause more severe problems in cats. And other than that, when co-infections caused by other kind of viruses and pathogens such as panleukemia virus, FCV virus with Bordetella bronchi septica. So, this also leads to more severe diseases, and even the mortality rate of these kind of co-infection is more high, which will directly lead to death of the cat after few time of the infection. So when we talk of the immune response, so there are, of course, in the kittens will be there will be a passive immunity, which is because of the maternally derived antibodies (MDA). However, as in case of feline herpes virus, feline calicivirus, MDA also will last for 15 days, and which can be persistence as for 10 to 14 weeks. So that's why vaccination is also recommended for having a passive immunity for the kittens. However, in other situations, there will be an active immune response. So, which is because of the viral neutralizing antibodies production. Yeah. So after the infection, it will be like post after 7 days of post infection. So antibodies will start appear in the body, in the blood. Yeah. So infection with other strains will also reduce the acute clinical signs and oral shedding significantly. So this means that when, as I mentioned, there are so many strains which can cause infection, and that's why the effect or the clinical signs will also be different. However, when there is an infection of one strain, the acute clinical signs will be very less, and also the shedding will be in a controlled way and will be over in soon. So when we talk about the diagnostic methods of feline calicivirus, so similar to the feline herpes virus, the first is the PCR, which is the golden standard test, which can detect the nucleic acid of feline calicivirus. So of course, RT-PCR test is have a higher sensitivity. However, the qPCR test will give you, like a quantitative results where you can know the viral load in the positive samples. And also the sampling is same as mentioned before through conjunctival and oral swabs from tongue area, oropharynx region, blood, or lung tissues. And the factors which are affecting PCR, RT-PCR in this case are of course, the sensitivity and the specificity of the assay, and also when the time of the sampling, depending on the other factors such as storage and transportation. Yeah, and also high variability of the viral genome. can give you, false negative results. So yeah, that's the issue with PCR test in the feline calicivirus case, that because of the high variability, we can have false negative results more often. So other than that, we can use the virus isolation, where we can culture the virus to see the presence of replicating virus from the samples, collection from nasal or conjunctival or oral pharynx region through the swabs. So the factors which can affect this kind of method, where we have to culture the virus, is that there can be a low number of variants in the sample. So that's why the in vitro growth will be very bad or not very good. Yeah. And also the viral would be positively can be in an inactivation stage. So yeah, during the transmission. So that's why the viral will not grow in vitro. And also the presence of antibodies in the extracellular fluids in the samples, so that can also prevent viral replication in vitro. So yeah, this method also have some limitations, yeah, but this is another method can be used. Other than that, there are ELISA methods which are also present in the market to be used for detecting the viral neutralizing antibodies. So limitations of this method is that whether the cat is showing natural infection or it's because of the vaccination. And false negative results can also be because if virus neutralizing antibodies would not cross react with the laboratory stains used in the test. So yeah, ELISA has its own different limitations, but yeah, this is also another method, reliable method can be used. So talking about the treatment of feline calicivirus, since it's also very common cause of respiratory infection, so there are intensive nursing care and supportive therapies there in the market, which can be choose to treat the cat, infectious cat. And also there should be a proper food intake, yeah, so that cat would have high energy through high energy diets. And for the safer side, we can use some non-steroidal anti-inflammatory drugs such as moropinitant for fever and other oral pains. Yeah, so if there is a nasal discharge, so yeah, it is recommended that nasal flushing should be done on a regular basis using saline water. Yeah, please. It's not recommended to use tap water, because tap water already have different pathogens, or you can say bacteria or other environmental microorganisms, which can increase more severity and cause more severe infections. Other than that, there are some solutions such as bromohexamine, which can also be used to clean the mucosa nasal discharge. Yeah. So there are some antiviral therapies also in the market which can be used. But of course, there is nothing specific for FCV. But still, some of the drugs such as ribavirin, feline interferon omega can be used as an antiviral therapy. Other than that, recently in 2014, this drug named as Felicillin is very popular in Germany, for which is actually used for the treatment of feline calicivirus. So when there is stage of FCGS, so yeah, we can use the broad spectrum antibiotics to treat those kind of chronic symptoms or clinical signs. And there is also recommended that we should properly do the dental cleaning, and we can use some chlorohexamine to apply in the oral and dental area. Other than that, glucocorticoids can also be used, and some kind of immunosuppressants and immunomodulators such as chlorambucil ivermectin and cyclosporine can be used for the treatment of FCTS. Yeah, in case of epidemic situations such as VS-FCF infections, yeah, so this is more severe where cats need more supportive care through intensive care units, where fluid therapies, IVs, or broad spectrum or specific antibiotics can be given, should be given to the cats. With that, we supportive treatment can be through glucocorticoids or the use of feline interferon omega can also be given to the depending on the severity of the epidemic. Yeah. So this was all about the treatment methods for both the viral situation, infectious situations, when the cat would show you some clinical signs and we look for some kind of a treatment. However, in general, vaccination is the most important thing that can be done for the prevention of these diseases, sorry. So a vaccination is, in case of vaccination, it also cannot prevent the infection, but it will help to control the viral shedding and also to increase the condition of the cat. So there are different kind of vaccinations programs present in the market, but the most common one in case of the cats are the attenuated live vaccines, inactivated vaccines, and also intranasal attenuated live vaccine. So basically, all these three kind of vaccines are present in a combination as a bivalent product, such as combination of FCV and FHV, or with additional antigens such as FERV, FPV, etc. So these are some basic AAHA guidelines which are followed by the veterinarians throughout the world. So here I can discuss few of them. So for in case of pet cats, which are pets, so usually the attenuated live vaccines are used. So when this vaccination is administered into the kittens, which are less than 16 weeks, so we have to wait until 6 weeks of age of the cat when the first dose has to be administered in the cat, followed by 3 to 4 weeks until 16 to 20 weeks of the age. Then the first dose can be given. Other than that, the cat who are older than 16 weeks, so 1 or 2 doses of a combination vaccine can be given. And considering the revaccination, so 6 months of the age, rather than for 1 year of age, can be given as a potential window period for suspectable if the kitten had MPA or not. So yeah. So revaccination, yeah, and for the other cases, revaccination can be 3 years thereafter, yeah, after the first dose. So in case of intranasal attenuated vaccines, live vaccines, so in this case, this is more, given through the nasal area. So yeah, so for this one is also, for the kittens is similar that not earlier than 6 weeks of the age, the first dose has to be given. And for the older cats, more than 16 weeks of age, so 1 dose, then yearly thereafter. And revaccination, of course, is annually. And revaccination also is helpful in mitigating the upper respiratory infections in different stress conditions. Yeah, so and in case of shelter cats, yeah, this is a little bit different because the disease prevalence is very high. So in the case of a kitten, so single dose at intake or where possible can be given for at least 1 week before the kitten is going to enter into the shelter. And the first dose has to be after 4 weeks of the age of the cat. And it can be then for 2 weeks until 16 to 20 weeks of the age, the first dose can be given. But the cats which are older than 20 weeks, and for the adults, so single dose at intake or where possible, at least one week before shelter, before entering the shelter can be given. And other than that, the second dose can also be administration after the 2 weeks of the first dose. Yeah. So in case of intranasal attenuated live vaccines, so this kind of vaccines is not recommended as this is more, specific to the area. So that's why in case of the shelter cats, so this kind of vaccination is not recommended. But other than that, we can have the other guidelines such as vaccination will provide mainly by inducing humoral immunity in cats. It doesn't, it matters by what vaccination program you are choosing, which will onset the immunity within 7 days after vaccination. And of course, the cats which are present in the crowded area, crowded situations, so revaccination, yeah, is always recommended on yearly basis. So, so to follow this vaccination things in the cat uh, for the proper treatment of feline respiratory infections, so we can do the regular vaccinations against FCV and feline herpes virus. And also the booster vaccinations should be recommended to the queen in case of the in case when the cats or the queens are used for the mating or purposes or during pregnancy, because during pregnancy also when the vaccination would create neutralizing antibodies that can help to increase the MDA in the kittens. So in case of oral cats, so that can receive 2 injections, yeah, after an intervals of 2 to 4 weeks, and also the booster dose is also recommended yearly basis. Doesn't matter they are pets or in a shelter, yeah. And also cats present in the crowded and high risk regions, yeah, revaccination is always recommended, yeah. So last but not the least, yeah, so the most easiest way to have the disease management is to avoid the stress and to provide a considerable good environment to the cats and having that managed for the good living of the cat. Also, other than that, a good hygiene is also considered, where if the cats are living together with other cats, they should have a proper hygienic situations. Yeah, in case of nursing areas and cat hospitals and other places where the cats are being treated for different kind of diseases, yeah, there should be a proper, partition in those areas and also effective barriers in between the nursing areas. So yeah, and in that case, there should be a proper cleaning also through disinfectants and using bleach, to clean the environment. Yeah. So yeah, these are the some of the disease management things which I also have covered. So yeah, with that, thank you so much for your attention, and I hope that this webinar would have helped you to gain some insight of uh, feline respiratory infections, mainly caused by feline herpes virus and feline calicivirus. Yeah, and now I would like to open our session for Q&A. So if you have further questions, yeah, you can type your questions in the chat box. And also, if you have joined this webinar but haven't registered, yeah, so please leave your email address to get the certificate after we close the webinar. Yeah. hello. Can you repeat the question?
How long does the regular virus infection last?
Oh, for the typical calicivirus infection. So once a cat is exposed to calicivirus, yeah, it can last for the incubation period is of course 2 to 6 weeks, and it will last for 14 to 21 days. So yeah, as I mentioned in the career stages of the cats, yeah, it can be up to 1 month, most of it up to 1 month. Then it will enter into the uh, clinically, clinically healthier stage. But yeah, the virus will still be there, maybe doing mutations in the body. Yeah. Does the weight of the cat impact on the first dose of vaccination? Talking about the weight of the cat, I think that will not matter because the vaccination program is for kittens as well as the adult cat. So that's why the weight of the cat would not affect. However, the weight is more effective when you are administrating the drug or giving some kind of treatment to the cat.
Okay, I got another question.
Yes.
What is the prognosis for a cat infected with FHB?
Sorry, can you repeat the question?
What is the prognosis for a cat infected with FHB?
So the prognosis can be that you can, first of all, there will be the thing that you need to detect the virus correctly. Like it's easy to detect, but like the cat has a severely infected, or it's because of the vaccination issue that the viruses get detected in the cat. So there is actually, after the detection, there is no cure for in case of herpes virus infections. But other than that, there are some therapeutic goals which can reduce the frequency or the severity of the reoccurrence. So as you know that in case of herpes virus, yeah, there are not much variant present in the environment. However, during the stress conditions, the carrier, the cat will have a virus inside, and then it will start shedding. However, in case of calicivirus, after the virus is, we know that the cat is infected by the virus, and to control the shedding of the virus, or like to spread it into the environment, uh, the the environment of the cat is very important, where the cat is living. So that's why the proper cleaning and hygienic conditions are more important for the longevity of the survival of the other cat present in the same environment. So here's another question which says, can explain more on nasal flushing with saline and some things in case of FCGS, and how to do the treatment. So yeah, for the issue of nasal discharge, yeah, it is recommended that we should use some kind of saline solutions to clean. So usually there are some tubes which are present in the market, which can fill the fluid inside that, and from one nasal the fluid is injected, and from the other nasal the fluid will come out to clean the nasal passage. However, if there is a thick mucosal nasal discharge, yeah, so of course we need to use some kind of solution such as bromohexamines, which will effectively clean the mucosal area, causing less irritation and less discomfort to the cat. Yeah. There are other questions. So, can the viral disease cause blindness or infection of the eye that lead to the damaging of the eye? Yeah, that can be a possibility because the ulceration keratitis of the eye area can cause blindness in the cat because this is a chronic kind of stage where both the virus, the feline herpes virus especially, cause ulcerative keratitis in the cat. So that's why in the later stages, yeah, this can occur. Yeah, that's right. So with that, can the vaccine is recommended once the virus affect the cat? The I that's not the case. Vaccine is still recommended in any way. When there are some programs available, then the cats are recommended to do the vaccination. Uh, the reason is because as these viruses are very prevalent in the environment, so depending on the percentage of prevalence, as I mentioned, that if it's a household cat, the percentage in both the cases will be 10%. However, if the cat is living in a shelter area or in a group, yeah, the percentage would increase. So that's why vaccination is always recommended. Yeah, because depending on the health of the cat, so vaccine will also affect in a similar way. So yeah, for the kittens, yeah, of course there are vaccination programs, but yeah, after each year for the booster dose or other things, it is always recommended. So that's why I share the AAH guidelines, which is followed by the veterinarians for the vaccination of of the cats for herpes virus and calicivirus. Okay, so I will take two more questions. So one is when to give a booster dose during pregnancy, whether at the beginning of the pregnancy or the late pregnancy. Uh, I think for this one, I'm not very clear, but to my knowledge, I guess the later because if the cat is already having a vaccination program, so suppose the cat has vaccination at certain point of the period, so we need to calculate because otherwise the cats are usually vaccinated once a year, right? And in between, if the pregnancy can happen, so what's the stage of vaccination at that time? How much the period has already passed? So yeah, if it's very late and it's almost time that the cat may have to have normal booster dose also. So yeah, so you can do the vaccination at accordingly at that time. And of course, yeah, the late pregnancy is much more better because there is a time that after 2 to 3 7 days the neutralizing antibodies will start be producing into the body. So yeah, late pregnancy is more reliable because there will be a more longer period for the vaccine and produced neutralizing antibodies to enter into the blood of the kitten. Yeah. Okay. Next is it possible to combine traditional ingredients in the treatment and care of the cat? Uh, okay, so it's also mentioned by the name the Day from Day from Indonesia. So hi Day. So yeah, I think traditional methods are very regional. So not all of them are familiar with those methods. And sometimes you also know that traditional methods are more general or broad spectrum methods. So of course, if in your region there are some methods which we are not familiar with, which are used for the treatment of for the cat, uh, but either because we don't know that these methods are for viral treatment, bacterial treatment, fungal treatment, or whatever. So you need to make sure that doesn't matter the clinical signs are improving or not. Our main goal in these kind of infection is that the cat should, even the cat is carrying the virus, it should not have like frequent shedding of the virus. So that's how we can control this condition for the cat. So that's our main purpose, because these diseases are so common these days. So yeah, controlling the shedding for infected cats is more important. So yeah, if these traditional ingredients can help to control the clinical signs, well and good. To, of course, to combine with other kind of treatments available or suggested by veterinarian. Yeah. Yeah, I think it's almost 9:15. So yeah, so I still have some of the questions in the chat box, so which I will reply uh, to you guys. But I haven't seen any email addresses, so yeah. But anyway, we have to, because of our time limitation, we need to close today's session. And I thank you, all of you, whoever participated in our webinar. And I still give you 1 minute. If you have joined late and haven't really registered, you can put your email address into the chat box so that we will be able to send you the certificate. Uh, because if you have attended the webinar more than 50 minutes, yeah, you are eligible to get the certificate, yeah, from us. So yeah,